Welcome to another episode of the Moore Center Community Spotlight. I'm your host, Teresa Dinesi. Today we're going to learn a little bit more about how the Moore Center supports the behavioral health of the men and women they support. And I'm thrilled to welcome two folks from the Moore Center, Kate Freeman and Carolyn McAllister. Welcome, ladies.
Thank you.
So nice to have you. So, Kate, you're the board-certified behavior analyst, and I know, Carolyn, you're the manager of emergency temporary placement. Let's talk a little bit about behavioral health needs of this population and why it's such a need right now.
Certainly. The program that I manage is a group home. It's a 3-bed group home for individuals that are in crisis. And so very often we take folks that are in the emergency room or might have enhanced behavioral needs or medical needs and might need additional supports that they weren't previously receiving. Kate is our board-certified behavior analyst and consults with our program so that she can provide additional behavior support so that individuals can move on to a more suitable placement.
Sure.
That would serve them better.
Yes. Can you give an example of sort of what a crisis situation might be for those that might not be familiar with this issue?
Sure. So if we had an individual who was living with a family member or in what we call adult foster care, if they start having increased behavioral needs and they have high levels of aggression and the person that they're living with can no longer support their needs, then they might give notice is what it's called, and they would end up coming to our program, and we would work pretty closely with Kate to try to figure out how we could develop a suitable program for that individual.
Okay. Basically, coming into the ETP Home, they're, like you said, they're in crisis, and we're really just looking to get them back into baseline, have them stable so that they're able to move on to their next home, whether it's back to that provider, back to the family, or they're locating somewhere new. And I think it's really important to note that getting back to stable really takes a little bit of time and a lot of support. So I'm working with Carolyn and her staff to really minimize those target behaviors, the problematic behaviors. In this home, I'm not too focused on increasing any replacement behaviors. But the nice thing about the home is that if the team and the client and I form this relationship, I can see the client onto their next home. So I've done that with at least one of the clients here at the Moore Center. They transitioned to another home, and I'm their BCBA overseeing kind of their services right now. We saw a lot of success in the home, so it was nice to have the guardian and the team say, you know, we'd really like to see you kind of move that client into the next home and see what we can do and continue.
Great. So tell me about the house, the home that they're in. How many beds are there, and sort of, how long do they stay with you?
Certainly. So it's a 3-bed facility, so we can house up to 3 individuals. We can take anywhere from 1 to 3. Depends on, what's going on at the time. We typically would keep somebody for 30 to 90 days. We try not to keep anybody longer than 90 days. And so typically we try to, when somebody comes into the program, we try to establish what we call triage meetings with the team that we will have every week so that we can determine how long that individual will be there. We have one-on-one staffing. We have 2 staff on the overnight, 11 staff total, I believe. An assistant manager, a registered behavior tech, which is a position that Kate assists in overseeing, so that they do a lot of data tracking. We are local in Manchester.
Is this a new home? Is this a new program for the Moore Center? Can you talk a little bit about the longevity that's been in place so far?
Yeah, it's brand new. We opened, about a year and a half ago, I would say. And just kind of, I think the problem is that the state, it recognizes that there are a lot of people that end up in the emergency room, and that there's nowhere for them to go.
So there's a tremendous need in the community right now for this type of program.
Certainly, yeah. So a lot of times we take people out of the emergency room rather than out of their home. They're sitting in the emergency room. There's nowhere for them to go. There's not a place that can support them appropriately. So we're one of the only facilities that will take somebody that doesn't have a receiving address, so then they can come to us.
So the Moore Center is pretty unique in this area, for sure.
Yeah. Yep. And I've been with the Moore Center in this position for about a year and a half, ironically, just as the time that the ETP program was opening up. And I'm the only board-certified behavior analyst working for the Moore Center right now. And I think that lends a hand to be able to have the RBTs come on. So myself, any RBT, any BCABA working for the Moore Center or any other agency, we are bound by the Behavior Analyst Certification Board. So not only do I work for the Moore Center, but I have to make sure that I follow the guidelines under my boards as well. So we offer that supervision. So if anybody who's looking to come on and work with the adult population, at least I can supervise them to obtain their RBT certification or their BCABA, which is a board certified assistant behavior analyst. And I can also supervise a candidate hoping to become a BCBA, just like I am.
That's wonderful. So there's a lot of stress in your job, but there's also must be a lot of rewards. What's the best part of what you do?
One of the things that I think is kind of important is that we all recognize the growth of, or the increase in the population of adults with autism, and it's only going to get bigger, and
a huge influx coming in.
For sure, yeah. And so behavioral support is really huge in providing the appropriate supports for those individuals, and so we see kind of a new population aging into adult services. So it's really kind of neat and interesting to be a part of that, because it is such a spectrum, and to be able to help people.
It's always evolving.
Yeah. To be able to help people when they're in a moment of crisis is really quite special.
Yeah. And the science that we use is called applied behavior analysis, and a lot of the children who are aging into adult services, if they've been in the public schools or even private schools, they're receiving ABA services. So things that I'm going to be able to meet with their BCBA and reconnect and rediscover within adult services, it just makes it a smoother transition for when they're moving into our program, which is really nice.
They also very often, it seems like maybe the stigma is that adults can't change their behavior. Once you get all of these services as a child, and then when you age into adult services, that kind of stops. And so to recognize that that's actually not true, and that you can change behavior, and you can, create a better life.
Sure.
Yeah.
When these folks are getting ready to transition out of the home, it must be gratifying to see that progress and that improvement. I imagine that must be very gratifying for all of you.
That's the best part.
And where do they go when that process is about to start, when they are getting ready to transition out of the residence?
So it's different in every case. We've had some folks, we've had 13 individuals in the program, and I think it's been 16 admissions over 13 people. So 3 people we admitted twice. And we've seen people go to other residential group homes. Some people have gone back to their families. The program that we would call adult foster care is another model that sometimes people transition to. On the rare occasion, they'll transition out of state to a facility that is, I guess, a bit more...
For more intense needs.
Yeah.
Sure. They have a bit more supervision than we can provide, and that the clients need to succeed.
Gotcha.
Yeah.
So as we wrap up, I know, Kate, you were talking about how your role has sort of evolved with the Moore Center, and it seems like a lot of people that I speak with, there's opportunities for advancement. Are you folks looking to hire anyone in these roles, or are you interested in recruiting any open positions at this time?
Always. I think it's really important, especially in my position. A lot of people who do what I do, they're working with children, and I think it's important to know that working with adults, the behavior change is a lot slower. But the thing that keeps me going is that with working with Carolyn's staff or the providers that I work with, getting their buy-in. So that second that they see that change in behavior, or that outing wasn't as stressful as the last outing, and they want to keep doing it, and they want to keep learning from me. I think that's the best thing about this position, is that I continuously kind of push my team to try new things, and we're out there getting different jobs. A lot of people think that our clients are supposed to be baggers at Hannaford's and Market Basket, and they can be if they want to be, but they can also be anything that they want, and that's why Carolyn and I are here. We're hopefully getting those clients to do their dream job, or any type of modification that they might need.
Sure. And if someone is interested in applying for a job, what type of position would you have open, or what type of background would you be looking for? Is this something where a person who doesn't have any experience in human services could possibly apply? Or
Sometimes those make the best staff, the people who are so green, and they really are just coming in with their heart. You would start out as a direct support professional, and we've seen a lot of those staff really work their way up. I know I did when I was down in Massachusetts. I was
wonderful.
a DSP, and I've been in the field for about 10 plus years, and you have too.
Yeah. I think that we're in the middle of creating an employment or a DSP, direct support professional ladder. So we absolutely will take, we'd be interested in, meeting with anybody or interviewing.
And I know we have a nice section on our Moore
Yeah.
Center website for employment opportunities,
Certainly.
so people can certainly take a look at those.
Yeah.
Wonderful. Well, Kate Freeman and Carolyn McAllister, thank you so much for joining us today, and thanks for all that you do with the Moore Center. We're really appreciative.
Thanks
Thank
for having
you.
us.
I'm Teresa Dinesi. Thank you for joining us. We'll see you next time. The Moore Center is a nonprofit statewide organization with a legacy of serving others for over 60 years. We provide compassionate, high-quality, cost-effective services to people of all ages, from early intervention services for children, to programs and services for adults with developmental disabilities, to home care services for seniors wishing to remain independent in their own homes. We also provide training for the human services workforce. To learn more about this award-winning nonprofit organization and its rich history of creating opportunities for a good life, please visit us at morecenter.org.